This section, part 3, is about the intraseptal injection and a review. So if you'll look up here at the number 1 up here, it's the pink, and it will say teeth anesthetized. It has an unreliable pupil. That's why on this it's a little lighter. The soft tissue and the bone are definitely get anesthetized. And sometimes the pulp does, and sometimes it doesn't. It's just unreliable. The nerves anesthetized are any of the terminal nerve endings at the site of injection in the adjacent hard and soft tissues, just not real sure about the pulp of the tooth. And the area anesthetized are bones, soft tissue, and root structure in the area of the injection. So when would you give this? When you need to have pain control and bleeding control for the soft tissue, and also you need to have that bone, not necessarily the actual tooth. It's hard for them to tell you that they are feeling numb because there's a complete lack of lip and tongue anesthesia. And this is a lot of the reason why these, like I've said before, these supplemental injections are popular with kids and especially the dentists. We don't do too much of this with SRP, although I have done them when the people just cannot get anesthetized, but it's very rare. But the contraindications of any of these would be infection or inflammation, as always. And when you're going in through the papilla, there's usually like 0% positive aspiration. But these supplemental are great because you don't have any residual numbing. So they're not going to be biting their lips, and there's no soft tissue, lip, and cheek numbing for at least, for the 2 to 3 or 4 hours. This is going to be just a bit of review. If you're going to do a quadrant treatment, you want to give the injections in the order of the PSA, MSA, ASA blocks first, the maxillary facial injections. And then if you need to give palatal, you'll give those palatal after you give the facial. And then you would begin instrumentation on number 1 maxillary quadrant, the molars first, and then work your way toward the anteriors. Then you proceed to the 4th mandibular quadrant, and then so you're going to be doing upper right, upper left, lower left, which is what those quadrants are. In case of any failure in an IA, you're going to reattempt at first at a level just slightly higher or superior to the first injection. That's good to know. So following an IA, if you have incomplete anesthesia, it could mean that could mean a lot of things. But one thing it could mean, I think I touched on this in another PowerPoint. There could be a bifid inferior alveolar nerve, and there is in just 1% of the population. So you could have the lingual shock here. Remember that. You have that possibility of a shock more on the lingual of an IA and the mental incisive than you do really any other one. So just to review also, the IA block has the highest positive aspiration rate of all the blocks. Recommendation is that you would always aspirate in 2 planes and re-aspirate after every 4th cartridge of anesthetic solution. So I added this in here so if something is like this on your boards that you would know that you can do this. But I don't know anyone who does this. If you aspirate in 2 planes and you come up negative, you should feel good about injecting. But what they're talking about, I think, too, is that to make double sure, you would do a 4th of a cartridge and then re-aspirate, and that's just making sure that you have a steady fulcrum and that your needle hasn't moved slightly up or mostly in a upward maybe position to where no, it is in one of those tiny little blood vessels. You could have paresthesia may occur following a block. And that is if you go through and hit up into the parotid gland. And so by following all of the guidelines that you have, that is not necessary for that to even to worry about. So sometimes you'll give bilateral incisive mental blocks, and it may be useful for just sextant, like canine to canine treatment. If someone is missing their back molars, which sometimes they are, and they just have like premolars, or missing a couple premolars but have a few on the other side, but they're mainly anteriors and your premolars left, you could give 2 bilateral incisives on each side, because neither of those will numb the tongue, which is the issue why we don't give the 2 IAs on each side at the same appointment, because each IA lingual is going to numb half the tongue, so their whole tongue would be numb, which is not good. This is just another view of bite marks that kids can make while they're still numb, and why it's such a big deal. But they're not the only ones who will do this. Your medically compromised or special needs patients, sometimes your perfectly healthy patients, teenagers, especially if they have braces or they've got a lot of appliance in their mouth to begin with. And anybody really can, and when they're numb, if they're not careful, bite their lip or the inside of their cheek while their soft tissue is numb for possibly 3 to 5 hours. So we always tell them before they go home, to really be careful about trying to chew on the opposite side of their mouth until the numbness wears off. And that's the end.